Hello everyone, thank you for joining. We'll be starting our session soon. We are waiting for Dr. Parag to join. Yes, now he's here. Guys, there has been some network issues, so we are facing some problem. We'll be starting in a minute.
Sir.
Yes.
Hello.
Hello, sir. Good evening.
Yeah, can you hear me?
Yes, sir. So we can hear you.
Okay.
Yeah.
Yeah.
Yeah. So today we have Dr. Parag Sancheti. By name, he is a brand himself. He is working in a orthopedic setup since long, and he is also currently chairman and managing director of Sancheti Group. Yes, sir. So, uh, usually what happens is the first generation entrepreneur have a fire in their belly to grow and expand their empire. So as we have heard from K. Sancheti sir, that he had that fire to grow and had fire to fight. So now it is harder for second generation to sustain with the same passion and fire. But we are blessed to have you as our boss, sir, and you have maybe some other passions, some other fire in you, which has made Sanchiti grow on other level. So, sir, I just wanted to ask what new things that you have brought to the table, and because what happens is usually you have to grind before you get the glory. So, what got you in this position, sir? We would like to know your story, sir.
Yeah, first of all, thanks Manish for this invitation to be in this Instagram live. This is the first time actually I am on Instagram, and that's why I was struggling to join. Sorry about that. But I'm really thankful to you for having invited me first. And definitely, being a second generation has different advantages and disadvantages. As all of us know, KHS has, more than proved himself. He's made a big empire. He has a legacy, and to carry forward that empire, to carry forward the legacy which he has created, is definitely a very very challenging task. He could do it. He has done it, but now the second generation, which I am a part of, requires to take it forward. The most important thing I feel while doing this is to understand what is the legacy created, what has he made, and how we can enhance the legacy, how can we enhance the brand which has been already created, and not let it go down. So once I finished my MBBS, I did my MS in orthopedics and joined Sancheti Hospital in 1992-93. Then that is the time I really started thinking, because my MBBS and MS was at BJ Medical. Until then, I didn't have any direct contact with KHS sir and never worked under him. But since 93 January, I started working, and I still remember the first day I joined, there was a free plastic surgery camp by Dr. Sharat Kumar Dikshit, and that
Mhm.
was my entry to Sancheti Hospital to work under Dr. KHS. And that was itself very good, because that was a social initiative by Sancheti Hospital and Bharatiya Jain Sangatna, and that gave me a kind of insight to what all activities were going on in Sancheti Hospital. So that was a completely free camp, completely
Mhm.
sponsored by Bharatiya Jain Sangatna and Sancheti Hospital, and thousands of patients were being screened by Dr. Dikshit, and more than 300-400 free surgeries were done. So that had a big impact on my mind. So that always has been in me to do some social work, to carry forward the social initiatives which sir has started. KHS sir used to do a lot of free polio camps, free cerebral palsy camps. So we tried to continue that. And the other thing also which we wanted to do to enhance the brand was a little bit of research and academics, and to start it as a subspecialty super specialty hospital, because all this time KHS sir used to manage all the subspecialties super specialties himself. He used to do spine
Mhm.
surgery, he used to do also get
super specialists. Like each person heads one particular subspecialty, may it be shoulder surgery, spine surgery, trauma surgery, hip, knee surgery, foot and ankle, pediatric, and we made people in charge and made them, get into the super specialty thing. So that gave us a different name. Apart from that, we entered into research. Research was something which was not being done at Sancheti Hospital, and we inculcated a lot of research culture. And in the beginning, it was difficult, but then we had our academic and research chair, Dr. Ashok Sham, who really brought that culture and till date drives that research department. That is something I gave a lot of importance to, and that created something different. So I think to answer your question, to summarize, that fire in the belly was always there, and you have a benchmark. You always have to compare yourself to what your mentor, your father, or the creator of this empire has done. And if you keep that as a benchmark, that itself creates a lot of fire in your belly. And then that itself is a Herculean task. So every day you're trying to match that benchmark, get close to it, and try and enhance the legacy and the brand.
Yes, sir. So I would say that everything was not served in your plate. You had to fight for it. So that made the fire in your belly that kept it alive.
Yes, yes, absolutely. So I agree. It was not everything on the plate. Some things did come on the plate, to get such a big empire, to be having
Mhm.
access to the big hospital, all the infrastructure, the facilities was on the plate. But the other things, I had to work around it.
Yes, sir. So it's not just you who has been on the significant position. Your family, your sisters, Manisha Sangvi ma'am or Rupal Sancheti ma'am, they have been working a lot and in different fields. They have like Manisha ma'am is in management, Rupal ma'am is in architecture. So all these things they are working. They have reached at some level. So as a family, how they have contributed to your development as a doctor as well as a human.
No, so I have three sisters. Elder one is Manisha ma'am, and the younger ones are Rupal as well as Sonal. And Sonal is the architect, so she is practicing in Mumbai. And Rupal is working with us at the Sancheti Hospital, where she takes care of the promotion and marketing activities. And Manisha ma'am takes care of the whole administration, and she's in charge for the Sancheti Healthcare Academy. So, they also are in the same boat like me. What they also were given by my father was the culture, the work culture, the legacy, and they also had to do improve themselves. So each one has done very well. As you know, you are in touch with Manisha ma'am, and she has developed the whole healthcare academy so well. She has started so many courses apart from physiotherapy. There's hospital administration, the dance therapy. There is so many other such courses which are going on, and that itself is a big achievement and again brand enhancement. That which KHS sir had started a physiotherapy college, but what Manisha ma'am did was something much more than that. Also,
Mhm.
Rupal ma'am was initially in Mumbai, then in Delhi, and then she came back and she had more experience with marketing and brand enhancement. So that itself was a compliment to us, and we started working on brand enhancement and marketing for Sancheti Hospital, and you can see that's going on. She also started a company called Helios, which is for home physiotherapy, and that itself is something unique which very few people have done, and that is rendering services to so many people, so many patients who require it. And even in this COVID times, I'm happy to say that program is still on, and the home care, home service through Helios is working wonders. Uh, my other sister is Sonal ma'am, and Sonal is from Mumbai. She's a leading architect. She has won many awards, and she runs a firm called as Opolis. She and her husband Rahul run that Opolis architectural firm, and you will see them very often on cover pages of various architectural magazines winning awards. She's also into academics and teaching, and therefore, as you see, that is what has come from our parents. My father, my mother, they have given us the work
Mhm.
culture to work hard, to prove ourselves, and that is what is definitely helping us. So, also in addition, what I would like to say is all my three sisters, and more so Manisha and also Rupal, have been helping me with my work. They have taken a little secondary role wherever I have been focusing on and given me the priority. They have made me the front face, and I really appreciate Manisha for that, and also Rupal, because whatever is my vision, they are supporting it. Of course, the Healthcare Academy is completely Manisha's endeavor. Helios is completely Rupal's endeavor. But when it comes to Sancheti Hospital or Sancheti Institute for Orthopedics and Rehabilitation and the new hospital which we are making now, that initiative is they are completely supportive of it. Whatever ideas I have, they will only complement it. They will not
Mhm.
compete against it or work against it. So that itself is a big help from my sisters for that. And in addition, we have a big family of consultants. We have 15 full-time orthopedic consultants, and they are also like my own family. I consider them. They are like my brothers. I don't have any brothers. So if you ask me who are my brothers, the orthopedic full-time consultants we have in the hospital, the trauma consultants, the pediatric orthopedic consultant, the shoulder, the foot and ankle, spine consultants, the research consultants, academic consultants, hip consultants. So all these people are like a family, and we are all
Mhm.
working under the single uh, uh, under with the single aim of enhancing the Sancheti brand and taking it to even higher place than what it is now. So that's the whole support I get from the family.
Yes, yes. So your own family, first family, and your extended family both have made impact on you, as you said. So, sir, as you have said that there are multiple branches in orthopedic which you had started. So, from that, one of your favorite topic which we know that is research. So in research, you have made a lot of publications. A lot of publications have been made since you have come, and then Sancheti has been shining in research since you have come. So, sir, I really wanted to ask: in these current pandemic situations, there are few restrictions for doing research because we cannot touch the patient. We cannot be in particular zone in the patients. So there are particular restrictions which have been coming. So how can we tackle that, sir?
Yeah, so first of all, just let me tell you a little more about how the research was initiated at Sancheti Hospital and, how the whole thing started. As I
Mm-hmm.
told you initially, we wanted to, do something which was not being done, and research was one aspect, one particular branch which we had not really done much work on, so we dwelled upon it. And then, once we had Ashok Sham with us, it was quite easy to progress with the research. And what we did mainly was to have research in orthopedics as well as to have more research in also the physiotherapy. So still we have the regular meetings with the physiotherapy students, especially the interns and the masters first year and second year. Initially it used to be 3 years, but now the course is 2 years. So we have both the years, and we meet every Thursday. Even in the lockdown, we've been meeting through Zoom and conducting and monitoring how the research is going on for each of the students. Same thing we are doing for the orthopedic residents. We have nearly 35 residents right now working with us, and all those have been given research projects, and they are closely being monitored how they are doing well. In addition to that, we have also set up some multicentric studies. We have an organization called as SKI, Society of Knee Surgeons of India, through which some multicentric trials are being done. So I think research is very important, and we have recognized that, and we are giving it due importance. And my job is to stimulate people, to help them to do research. I am not basically a hardcore researcher or a person who's a scientist and does research, but my aim is more of a facilitator, more of a catalyst. I just help to get the reaction going and just start it. And once it starts, then people are on their own and they do extremely well. The initial inertia is there, so we help to remove that. And that is what my job has been. I'm no researcher or no scientist by any qualification or also by my deeds. Currently, the pandemic which is going on is definitely, stimulating us to do more research. What we have understood in this close down and in this pandemic is that there are various other ways to see patients. Now, teleconsultation has suddenly become quite popular, and people are finding ways to reach us, even though they cannot come here physically. Virtually it is possible to connect, and that is one thing which we have seen. Also, we have seen that certain conditions could not be treated or could not be operated upon, and there are different ways to now treat those conditions, and they are getting better. Also, what we have seen in this period is that patients have a phobia to come to the hospital to come and get treated and get surgeries done, understandably, because the virus is still spreading. We are currently in the pandemic fully in Pune. The numbers have increased. Again, from day after tomorrow, there is a lockdown being declared. So it's a difficult and challenging time. So my take is that whatever we can do in terms of studying what patients we have done, and Ashok Sharma just recently set up a study that we have done some 350 operations in the last 3 months in the lockdown. So how these operations have behaved, how the patients are doing, what is the complication rate. So we are studying all that, and working also in the OPD, keeping social distancing. The whole pattern, if you see when you enter hospital, has completely changed. Everybody is wearing masks. Everybody's oxygen saturation is being measured. Everybody has to sanitize themselves. The staff is completely aware of the whole issue. And I think this pandemic has definitely taught us that how to deal with the situation, and the new normal has been created. And I think since we have a research approach, a research mentality, it has helped us in a way to cope with this pandemic. Everybody is dealing with it. Everybody is in the same boat, in the sense that nobody knows exactly what is going to happen tomorrow. When is the curve going to flatten? When is the appropriate medicine going to come? Is the vaccine really going to come? Is it work? So it's a situation and of uncertainty. So once there is uncertainty, you get stressed. So if you know the answers to all your questions, then you're fine, because okay, you know that now after 2 months the vaccine will come, after 1 month the medicine will come, then you're relaxed. But right now you don't know. There are so many unanswered questions than answered questions regarding this pandemic, and we have to just take each day as it comes. And definitely having a research approach to this pandemic has helped us.
Yes, sir. Sir, I was a student in Sancheti also. So basically, I would like to say that in addition to yours, you are not just catalyst, sir. You are pushing us to the limits, and that is what making it better, making the quality of the research better. So, sir, thank you so much for doing that. Thank you so much. Can you hear me, sir? Uh, Network issue. Sir just left us. We'll try to get him back immediately. So, as Sir said, it's the research is one of the very important aspects in Sancheti currently. So, sharing my experience, uh, we we as a student are a bit lazy. We don't focus on research. We just want to complete it and get out sometimes. But a person like Parag sir has been a motivator to us. He pushed us to the limits. He asked questions to us, so which made us better, which made our quality of research better. So hopefully Parag sir is joining back. And yes, sir. Hi.
We had lost connection.
Connectivity. Yes, sir. Yes, sir. So that's what I was telling them, that you have been a true motivator for us. In as a student, we were lazy and we need something, someone like you, and some motivation from you. So that was necessity. Yes, sir. Sir, now we'll come back again to your family. As a second generation entrepreneur, you learn something from the first generation entrepreneur. So for you, it is Dr. K.H. Sancheti. So what are the qualities that you immediately adapted from your father, Dr. K.H. Sancheti?
So there were many qualities which I learned from him. It will be very difficult to enumerate all of them. But whatever I am is because of him and his teachings and what qualities I have inherited from him. First qualities of doing hard work and never give up. Even at this age of 85, he's still, even though not coming to the hospital, he's maintaining his routine, getting up in the morning, going through his whole day routine, and is still
Mhm.
working really hard. So I think hard work is something, even when he was here, if he takes up some project, he will not really give it up. He will till it's accomplished and till it's completely over. So I think that is something which is very critical, and he has taught me that. Number two is, honesty and integrity. That is something which he has taught us. Always be honest in your dealings, because the kind of profession we are in is a very noble profession, and we have to give complete integrity and honesty to that profession. So I think that is very important, and I have learned that quality from him. Third is be of help to others. You are in a position to help others, and and help is not necessarily always monetary help. It can be any kind of help. In the medical profession, we can give medical help. We can do social work like camps and other such activities. So be of help, and whatever you can do to help, please help others. That is the third quality I've learned from him. So these are the three main qualities. First is hard work, never give up. Second is honesty, integrity, and third is be helpful to others. So these are the three main qualities amongst so many other qualities which I've learned.
Yes, sir. So now what happens is, making your own name is always difficult when your father is a big personality. Now you have made so much name by yourself. So, sir, we would like to know your success mantra.
Yeah, so there is no success mantra. I wish I knew the mantra, and then I would have given it to everybody. So, but just to continuation with qualities I have learned, you know, the success mantra is hard work. The success mantra is honesty, integrity, be helpful to others. But what I would say is that you have to have a vision plan, what you want to accomplish, what you want to achieve. There have to be some long-term goals and some short-term goals. So those, if you have planned, and then you work towards the long-term goals on a continuous weekly, monthly basis, and you work on short-term goals on a daily basis. So if you have some clarity on where you want to go, what you want to achieve,
Mm-hmm.
then definitely it helps. Because if there's no plan, every day morning you get up and you don't know what to do, what is your day looking like, you've not planned earlier, you just take things as they come, then it's not going to really work. So my success mantra is planning, having a short term as well as a long term vision, and ensuring that whatever is required to fulfill that vision, you do it, because just dreaming is no use. You should know how to reach to that dream. Once you've made a vision plan, you should know how to achieve it, accomplish it. You should have the know-how. You should have a roadmap with timelines to achieve that particular vision. And I would say that is my success mantra, if at all you consider me successful.
Yes, sir. Sir, thank you so much for your so much of valuable words and your valuable time also. Because in this situation also you are working every day, treating patients every day, operating patients every day, and taking time out and teaching us and telling us all these things. This was very helpful for us also. And thank you so much, sir. Thank you so much for giving us time.
Thank you, Manish. I
Thank you, sir.
appreciate your time and thank you for inviting me.
Okay, sir. Thank you. Yes. Bye bye. I will end the session now, sir. Yeah.